Not urinate. Some men have big prostate, so we have to put catheters for them to urinate through it. Some people, when they are going for surgery, we have to put catheter because we don't want anybody to mess up the place where they are doing surgery. So the bladder has to always be empty. So when the catheter is inside the patient's body, they cannot have the feeling to urinate. The urine just keeps what? Coming out by itself. Are we clear? So now if this is a foreign body, this is not normal. And you're putting it into somebody's body. So the body will see it as what? Foreign. And because it sees it as foreign, it tries to fight it and it can cause a urinary tract infection. Is it clear? Very good.
I have one question.
Yes.
Is this something they put in the urethra?
Yes. You go to the urethra. So
It's big.
it has different sizes. This is size what?
Oh.
This is size 16. This for a woman. It's not big. For men, I use size 18 or 20. Because men are bigger. For women, I use this one.
They are short to be.
I use 14 and 16 for women. This one is small now. Eh? For every person.
It's favorable for women, she said.
Then 16 is favorable for women. 16, 14, 16 is good for women. Men, 18, 20. Some men have to put 22. But if I put 20, like for you, to start leaking urine. They're very big. Okay? So we use catheter. Some of our patients, some of your elderly patients will be on catheter for a long time. People that their prostate becomes big. When the prostate is big, urine cannot flow normally. So we have to always fix a catheter. So this is a urinary catheter. So what are the signs of urinary tract infection that we say? Pain when urinating or burning sensation when urinating. The patient has a frequent urge to urinate. The patient is personally like little urine pot every time, and then they still feel that I still feel that there is urine in me. Do you understand? But they pass very little urine. The urine looks very cloudy, dark yellow, and even smelly. You see mucus in the urine. Patient has blood in the urine. There's fever in the urine. And for elderly people, most elderly infection is a urinary tract infection, especially our dementia patients. So they'll start having confusion. We told you that the first sign of infection for elderly patients is what? Confusion. So this is how you know your patient has a urinary tract infection. Are we clear?
Yes.
Alright. So we've talked about incontinence, we've talked about urinary tract infection. The next problem we have with elimination is diarrhea. What is diarrhea? Frequent stooling. So we'll say if a person stools more than 3 times and it is watery or loose, the patient has what? Diarrhea. And what can diarrhea lead to? Dehydration. Diarrhea can lead to what? Dehydration. Because the patient is losing what? Water and some other electrolytes. And because we're in a healthcare facility, we are very careful when the patient has diarrhea because there's an organism called the Clostridium difficile. This organism is very difficult to treat. It does not die easily. Even if you put it in 150 degrees, it does not like to die. It has 1 million lives. So you want to be very careful when you are with this patient because if this patient has Clostridium difficile and you come in contact with it, you also can get the diarrhea, and most medicines cannot work for it. Do you understand? So that's why you must practice what? Infection control with what? Your gloves, your gown, and your mask. Are we clear? So now, if the patient has diarrhea, you want to be careful when you're cleaning them up, especially because you know that diarrhea can, when you're cleaning them up like this now, the patient can do what? On you while cleaning up. So you have to always be careful. So we've talked about incontinence, we've talked about urinary tract infection, we've talked about diarrhea. Opposite of diarrhea is constipation. And most of us are constipated because we don't eat or drink water. We eat only bread and kobus. So constipation is when a patient has difficulty stooling, and the stool will be what? Very hard. that they'll be crying. So I always advise my patient, if the poop is not coming out, get up. Don't sit down there for long. So like don't tear your anus. You don't have to not get some sores in your anus. So what are the things that can contribute to a patient having constipation? Immobility. If you don't move, if you sit down for a long time, your intestines are also not moving. So it can lead to constipation. Not drinking enough water, not taking foods high in fiber. When you change your pattern, like for example, I don't know if it happens to you guys. If you change location, maybe you move from your house to another person's house. And do you go to toilet easily?
No.
It happens. You will
Even
not go
even
because
sleeping.
of change of environment. Okay, for instance, you feel pressed, and you go to the metro station and you see that the toilet is dirty and messy. Will you still be able to poop?
No.
What happens to the poop?
The poop goes.
It just disappears. Exactly. So now I know when the poop has gone, you might not be able to poop again the next day, like that. So this now builds up and constipation what happens. That's why we don't want to disrupt our pattern. If there's a change in diet, it can lead to constipation, like eating only food that are very hard. Aging, I already mentioned that as we age, we get what? Constipated because our digestion becomes what? Slow. Takes more time for us to digest. And then some certain medications can cause constipation. So when the patient is constipated, what happens to them? They feel heavy. Their stomach will feel what? Very heavy. They feel that they need to go to toilet. The anus is irritating them. Go to toilet, but by the time they go, it's not coming out. It's very difficult. So what do we want to do for this patient? We tell them increase your water, increase your fruit, increase your vegetable. If it does not work, we're going to do what we call enema. No, do we know what enema is? Okay. Enema is a pump. I don't know where I come from. As a little baby, my mother would put me between her legs, and then she would bring a pump and put it to my anus and squeeze water into it. They didn't do it to you when you were a baby. When were you guys born?
In Kenya, that's harassment.
That's harassment. Since it's only in this Gen Z generation that we hearing harassment. There's something like harassment in the African one. Gen Z now is harassment. I don't know if you are Gen Z now.
No, we are.
Yeah.
Can we go back?
Okay, so if a patient is constipated, we do what we call enema. Enema is, remember our scenes position, right?
Yes.
We place our patient in scenes position. The enema is like a tube and a pump. So there's water and soap inside it. So that tube has a little mouth. You put it into the patient's what? Anus. And then you pump. You're pumping the water. What are we doing? We're pumping water into the rectum so that it can make it what? Soft. Then the person can stool. It's a pharmacy. You can always go to the pharmacy and tell them you want
What about soap? Soap.
soap and water? Is that just because some people just use soap to lubricate
Yeah.
that area. Yes, you can use it. Or you can just go straight into your enema. So if enema does not work, what do we now do for our patients? What crazy?
They use the machines.
And bomb it is almost like enema.
Yeah.
It's almost like enema. If the enema does not work, we can also insert some medicine. We call them ducolas. We insert it into the rectum to also soften the stool, just like the way you're using your soap. Sometimes we can give some liquid for them to drink to soften the stool. However, the patient would not still go to toilet.
Yeah?
You have tried telling the patient exercise. You told the patient drink water. You told the patient eat fruits. It did not work. We did what? Enema. It did not work. We gave the liquid. It did not work. So this patient is now getting into what we call fecal impaction. What do we mean by fecal impaction? Because when you eat, remember that digestion ends when you have defecated, ends with the anus.
Yeah.
So now you've eaten food. Let's say this is the reservoir. The reservoir is our rectum, right? So when you eat food, it dumps down to the end and it is soft because it's liquid that moves in your intestine. So when it is soft, you eat again, more poop comes again, it's soft. The one that you put becomes dry. Do you understand? Again, it becomes dry. Again, it becomes dry. Put until it is filled up. When it is filled up, it starts irritating your anus. Go and urinate, go and poop, go and poop. But remember that the first poop that was here, that the first one that came in, is
It's
now
dry.
what? Dried. No more water. Very hard. That's why when you